Hello, I am Dr. Reddy, founder, medical director and chief retina surgeon from Neo Retina Eye Care Institute. Today I will briefly be talking about wide field fundus photography. Let me briefly explain what wide field fundus photography is. It's a conventional retinal photograph captures only central 50 degrees of the retinal field that you see as you see in this photograph, and you need to take multiple images of at least 7 in number per each eye to cover at least 150 degrees of field of view, which is not again a complete retina, and that needs to be processed with a special software to montage the image accurately. But Optos is one machine that we have at Neo Retina, in which we can capture a wide field retinal photograph up to 200 degrees on an undilated pupil, like you see in this photograph. You can see the difference between a 200 degree photograph and a 100 degree one, and all this without putting any dilating drops, undilated normal pupil. So how does a wide field fundus photograph help the patient as well as the doctor? Here is one. When for a routine screening which is required for diabetic patients, once a year retina screening, irrespective of whether there is symptoms or not, this is very invaluable tool to the patient, who can skip the dilating drops that are needed for a complete retinal evaluation, and all the difficulties associated with dilatation of drops, which includes glare, poor near vision, and inability to drive back home, and also probably patient needs to take half a day off to recover from all these problems. It is also comfortable to the patient, as he can avoid a detailed retinal evaluation, including indirect ophthalmoscopy, which surgeon mounts on its head, as well as slit lamp biomicroscopy, which involves illuminating the eye with a bright light that can be sometimes difficult for the patient to bear. Roughly the examination requires about 10 minutes after dilatation. All this can be avoided. For the treating ophthalmologist, this wide field fundus photography is a very great tool, as there is a digital copy of the retinal photograph with the doctor. We can see the changes that are seen over a period of weeks, days and years, and compare the changes over a period of time, and it avoids drawing cumbersome retinal diagrams, which can be cumbersome to the doctor, as well as there is a lot of inter-observer bias. Ophthalmologist also can examine this digital photograph, wide field photograph, and you can zoom them and pick up all the minute details at leisure without inconveniencing the patient. You can change it to red free, change the contrast, and pick up and stage the disease even more accurately, and we will make sure, and it ensures that we don't miss any small retinal findings. And it's more than above, it's also easy for an ophthalmologist to take a second opinion, seeing the retinal photograph, rather than calling the patient again and putting the dilating drops again and inconveniencing the patients. We have a campaign that we started in Neo Retina called a Smart Retina Checkup, where we advise all patients who come for a retina screening, including diabetics, to undergo undilated Optos wide field fundus photograph, and henceforth avoid all problems that are associated with putting dilating drops, and decrease the waiting time in the hospital. We recommend all those who come for annual retina checkup to take a photograph and get the image analyzed by the doctor, and avoid doctor consultation altogether, and decrease the burden on the treating doctors, as well as better experience for the patients, because this eliminates the waiting time and eliminates the dilating drops and all the problems associated with. Once the fundus photograph or the doctor determines that there is a serious disease burden, then of course we choose to dilate and perform some more tests, where like OCT or OCT angio, to plan the treatment, and all treatment including laser requires a dilatation. This undilated fundus, wide field fundus photography, a big boon for the patient, who can have a complete retinal evaluation without putting any dilating drops. Thank you.